Live on Your Health tonight, a new theory about the start of the COVID-19 pandemic. Here to answer questions about this is Dr. Todd Ellerin, the Chief of Infectious Diseases at South Shore Health. Thanks for being with us at the station today,
Hey, Dr. T. It's great to see you. Dr. T, as you can see, is in the newsroom. So, as you know, it's been 3 years since the first outbreak of COVID cases in China. We still don't have an official cause, but there have been a lot of theories. And the one that's getting a lot of attention right now involves so-called raccoon dogs, which aren't raccoons or they aren't dogs, but instead they're relatives of the fox. So why are some virus experts focusing on that?
Right, Eddie. So this is really important. And Katie Wu wrote an article yesterday in The Atlantic, really titled that we have more evidence now that this virus jumped from animal to human and was not a lab leak. Why? Because recently there's genetic evidence that showed that there was an animal called a raccoon dog. Like you said, it's more of a fox in this seafood market, and that it had the SARS-CoV-2, which is the cause of COVID-19. So now we know that humans had the same exact virus in that market as the animal did. Remember, if this was a lab leak, you'd expect one person to have one virus and to come out. And if they had gone into the market and infected the market, even infected the animal, you'd expect one virus. Another piece of evidence is that there were two viral strains in the very beginning. And what does that mean? That means that this virus had been incubating in something. And what we know now is it's likely the animal host, maybe the raccoon dog, maybe something else. Likely animal to human, not lab leak.
Interesting. Okay, well, and it feels like this headline, this kind of revelation came shortly after others talking about, in fact, a lab leak, and that some federal officials thought that the lab was the most likely source of the pandemic. So a disagreement here. Do you think it's important that we actually keep looking for the answer if we ever even find it?
Erica, super important. Why? And Katie, in her article yesterday in The Atlantic, ended by saying that, let's face it right now, we've had two outbreaks of SARS within 2 decades. The first one killed 800 people. This global pandemic has killed nearly 7 million people. It shows that we have a problem relationship between animals and humans, and we have to figure that out. Also, even if it were a lab leak, we'd want to know that as well to mitigate and put in safeguards to prevent that. But right now, really, we have to think about our relationships with animals in these markets.
Dr. T, if you don't mind, I'd like to take a few moments to acknowledge tonight right here on News Center 5, tremendous loss that you and the staff at South Shore experienced a year ago. Dr. Robert McIntyre was the chief of medicine when he died while scuba diving in Florida. How are you and your colleagues remembering him today?
You know, Dr. McIntyre was a great leader. Our hearts go out to Bob and, of course, his wife Susan and his 4 kids. I got a chance to speak to our CEO today, Alan Smith. He remembers Bob as a great leader, led our division at a critical time during the peaks of COVID. And we're remembering him as a great leader. He left a great legacy. You know, our hearts go out to him today.
Well said,
and I'm going to tell you one thing.
Yeah.
It's St. Patrick's Day. It was his favorite holiday. After this, I'm leaving. I'm signing out. I'm not going to do any interviews. My girl McHugh and I are going to we're going to go to the James, and we're going to have a Guinness, and we're going to celebrate his life.
And toast him.
Well done, Dr. T. Well done. Great to see you. Have a great time.
Me too.
Yes.